Chapter, we're going to be talking about health and disability income insurance. Last week we talked about protecting our stuff. Now we're going to be talking about protecting ourselves. We're going to break this up into two videos. First video going over some of the general information regarding insurance. The second video getting into some of the actual programs that go along with it. First of all, when you start thinking about health insurance, it's primarily to protect yourself, okay? Easing the financial burden that we might have as far as we get sick, we get hurt, something like that. And again, like any insurance, what you're doing is you're paying a premium in order for them to take on the risk in case something happens to you. Now, group health insurance is typically where you don't have a personal policy. You're actually in with a group, and most times people are getting that through where they work. Where they work will have a group insurance, and it's much cheaper there than it is buying an individual policy like that. You can see there's some other things. We'll talk a little bit later on about the Affordable Care Act and some of these other things. Individual health insurance is for those who do not have something through their work, or maybe they're dissatisfied with what it is that their group plan is doing. You can go to any of the insurance companies just about and get yourself an individual health insurance policy. Most times it's going to be more expensive than a group policy. Now, you may hear about COBRA. COBRA is basically, it was a law that was passed where if you leave your company for some reason, say a downsizing or you get fired or something like that, you have several months of insurance coverage while you're trying to find yourself a new job from the company where you left. All right. And so you do have some protection there as you're making that transition. Now, normally with COBRA, you're going to have to pay market rates and not the discounted rate that you would have had with the employer. However, you still can have some insurance. Now, in this section, it starts talking about what some of the things should be, okay, and what it is that you should be getting and what these various pieces are. So when you start talking about basic health insurance, we're talking about hospitals, we're talking about docs, we're talking about drugs, we're talking about all the things that go along with your health. You might hear about health expense coverage. That's primarily, okay, so I'm in the room, they're having to feed me and things like that. Surgical expense is paying any kind of doctor's fees that were actually working on you while you're in the hospital. Physician expense insurance is, let's say that you have a primary care physician, you go to that, you have a cough or you have a cold or something like that, you go to that doc. So there's some differences that go along with that. For all of these, you're going to have deductibles, you're going to have co-pays and these sort of things. We'll talk more about that as we go. Major medical is primarily if you get really hurt or you're going to have some kind of major surgery or something along those lines. What it does is it covers all of that. Comprehensive is including any of the other physician expenses that you might have. They're your primary care physician, you're sick, you go see them. Comprehensive is covering that. Now, you may hear about indemnity policies, okay? Indemnity policies where they pay you a fixed amount for each day that you're there. It is a supplement to all the other plans that you have. You may have seen the commercials for Aflac and the Aflac Duck. That is an example of an indemnity policy. What it's doing is it's coming in and you pay this extra insurance policy, and anytime you have any kind of major medical or something like that, it's helping to pay the co-pays that you would have paid for that. Dental insurance, okay, that will help you with your teeth. Maybe you have where you work has vision care insurance. So typically you can get new glasses once every 2 years. There's typically a max amount, like $1,000 or something like that, as far as your vision care insurance is concerned. Dread disease policies are a ripoff. In other words, you can buy an insurance policy that says, okay, well, if I come down with lung cancer or something like that, they'll cover all that. That's kind of a ripoff. It really is. Long-term care insurance is for those who may wind up going into a nursing home or something like that for a long period of time. And what it's doing is it's paying for the nursing home, which is not cheap. Some of the things to think about and some of the terms to be aware of. First of all is eligibility. Okay, and so eligibility is going to be varying. Are you eligible to purchase or to be a part of that group for some reason? Assigned benefits. Basically what that means is you have a bill that comes in or you go to the doc or something along those lines. If you have assigned benefits, the doc sends it directly to the insurance company. They pay the doc right away or directly. You don't have to worry about it. Internal limits is basically they're going to max out how much you can charge or how much they can charge you for a hospital room per day. So in other words, it might be $100, $200, $300 or something like that per day just for the room. What they're going to do is the insurance company is going to have a maximum amount that they're going to pay for that. A copayment is where you have to pay a certain amount for every time you go to the doc's office. Let's say that you're going to go to a doctor's office, and let's say any doctor's visit costs maybe $100. Well, the copay is you have to have skin in the game. So you're going to pay $10, $15, $20, $30, depending upon the insurance policy that you have, as a part of that. Service benefits are all the things that you are entitled to. What are all the things that the insurance policy is going to cover? Exclusions and limitations. There are going to be some exclusions to any kind of health insurance, particularly cosmetic surgery. They're not going to cover it. All right. Now, pre-existing conditions, the Affordable Care Act pretty much did away with that. We can talk about that a little bit later on. There could be some cancellation termination policies or circumstances within your policy. You have to read the policy and see what it is that there might be there. Now, there's different kinds of insurance policies. You could have reimbursement or you could have indemnity. Okay, reimbursement's paying the actual cost. Indemnity is paying just a daily amount for various things. Deductibles and coinsurance. In other words, you have to have a certain amount of skin in the game, so there's going to be a deductible. Let's say that there's, just like with our auto insurance, so you have a $1,000 bill and you have a $200 deductible. You have to pay the first $200. The insurance company will pick up the other $800. You're going to have out-of-pocket limits. In other words, all of the insurance policies are going to have a max limit as far as how much you actually have to pay. So in other words, let's say that you had some major surgery done, and because of the deductible actually hit, all the deductibles that you had to pay for all the stuff actually hit your maximum out-of-pocket limit. At that point, the insurance company pays the rest. When insurance companies are going to pay a hospital or a doctor, what they typically do is go back to what's reasonable and customary. Those terms. In other words, what is it that the typical physician is going to charge for this particular procedure? Now, if your physician is charging much more, the insurance company isn't going to pay them much more. They're going to say, okay, this is what's normally charged. That's what they're going to pay. Now, this is saying that what it is that health insurance must have as far as some of the stuff that they have there, as far as what it is that they include in their policy. At least 120 days of hospital room and board, provide at least a $1 million lifetime max for each family member, pay at least 80% of out-of-hospital expenses after a yearly deductible of $500 to $1,000. No, you're not going to find too many policies that have that as far as a yearly deductible of only $500 or $1,000. Based on what's been going on in the health insurance market over the past couple of years, your deductibles could be anywhere from like $5,000 or $8,000 or $10,000 as far as what it is that you're actually paying out of pocket before the insurance kicks in. Limiting out of pocket expenses no more than $3,000 to $5,000 a year, that's getting a little dicey too. So there's a lot of variation as far as the various plans are concerned. And what you have to do is you have to shop around if you're looking for the individual plans, or you just have to put up with the group plan if you're at work, if you choose to go with that. Now, private insurance companies, there's tons of them out there, and what they'll do is they will provide some of the insurance policies that are there. Now, you may hear about Blue Cross and Blue Shield. These were actually started around the early 1900s. Blue Cross is basically, these are basically by state. Okay, each state has their Blue Cross and Blue Shield. And Blue Cross is basically the hospital care. In other words, you go in the hospital, you have various surgery or whatever done, they will take care of that. Blue Shield is taking care of the physicians. Then you have health maintenance organizations. Now, what that is the insurance company will say, here are the physicians, here are the hospitals you can go to. This is how it works. It's much cheaper than some of the others. However, you don't have as much flexibility as far as who it is that you might be seeing. It's going to, plus another key of HMOs is that they try to focus on prevention and wellness. Then you have what's called PPOs, preferred provider organizations. You have more flexibility. You have various physicians who will be working with that PPO as a part of that PPO. And you can choose who it is that those physicians will be. Now, it will cost you more because of that. There's home health agencies where what they're doing is they will actually go into the home and help take care of the person who may be sick. Now, they're probably not going to be there 24 hours, but they will go in and help with the care for that person. And most companies are self-funded. In other words, they'll have a health plan, healthcare, health insurance plan, and they tend to fund it themselves. They're not going through a separate insurance company. What they're doing is they're saying, okay, we're going to collect all of the money that we kick in and all of the money that the employees kick in, and we will manage the insurance that goes with that. There's new accounts that have come out over the past several years, I'd say maybe 20 years or so. First of all, you have health spending accounts. What you do is you take money out of your paycheck pre-tax, okay, before you've paid taxes on it, put that into that health spending account. And whenever you go to the doc or you have some sort of an expense, you can put in a request to pull that money out to cover that. Now, health reimbursement accounts are actually run by the company. The company will set up an account for you, and they'll put a certain amount of money in that account for you each year. And what happens is if you have a medical expense, you put in a request to pull that money out for that expense out of that reimbursement account. Now, it's only so much that they're going to put in there. If you use it all up for the year, you're still on the hook for the rest of it. Now, let's say that you have a very good year personally, and you have money that's still in there, it carries over to the next year, which is different than flex spending accounts. Flexible spending accounts are where money is taken out of your paycheck pre-tax, and you can use that money for health insurance or for, say, things like daycare. You have to estimate, how much am I going to spend in medical bills and all this other stuff. You can take that money, put that aside, and kind of like a savings account. You're not paying taxes on that. And when you do have some of those expenses, you put in a request to pull that money out. However, if you don't use it all, you lose it. So you have to be real careful when you start talking about flex spending accounts and estimating how much are you going to spend this year, because if you don't spend it all that's been pulled out of your paycheck, you lose it. This has the comparison between the various accounts there. You can look that over in the text. What we're going to get into now, we're going to end this video. We're going to do a second video that's going to start looking at government healthcare programs and some of the other things that go along with it.